Hello, everyone. You are welcome to a brand new episode of Doctor in the House. And we are excited that you are joining us today, especially for the fact that we bring you, issues about the health and find solutions with all these problems that we talk about on these shows. And obviously, you'll be asking, who is the doctor in the house? Before we go to the doctor in the house, I want to tell you what we'll be talking about today. Today, we're going to be talking about the larynx and the voice. The larynx usually is known as the voice box. So today we're going to be talking about the functions, the anatomies, and maybe if there are disorders and how to fix them. Now, the doctor in the house is no other person than Brigadier General Dr. Nee Obodai, an ear and nose and throat surgeon and a former commander at the 37th Military Hospital, and now the medical director of Roseburg ENT Clinic at East Legon in Accra. So if you have your questions, if you're curious about anything that has to do with the larynx and the voice, send those questions via the WhatsApp number on the screen and we will get to ask the doctor here. This show is like a mini consultation before the main consultation, before your treatment. So feel free to send in those questions right here. Hi, Doc. How are you?
Hi, Chris. I'm doing well. Thank you very much.
Oh, Doc, it's nice to see you.
Same here.
All right, so today we're going to be talking about the larynx, also known as the voice box,
The
and
voice
also we're going to
box.
be talking about the voice. Yes, it's known as the voice box, but can you tell us the function of this and its anatomy?
Very well. Thanks for the question. The larynx, as we would describe it, well put out there as the voice box in ordinary language, or what we would call the Adam's apple sitting out there. You see it going up and down when you're swallowing.
Oh, that is the larynx.
It's the whole thing.
The Adam's apple is the larynx.
That is the larynx. That's the voice box. It contains the vocal cords, and they are the objects of our interest.
Okay.
The
Right.
vocal cords. All right. So the larynx forms that part just below the hypopharynx, and it has the junction entrance into the airway and then into the stomach through the esophagus.
Okay.
All right. So at that junction, you have it there. In front of it, have the cords that open into the trachea and then into the lungs. So that's the airway. And then right behind it, you have the entrance of the esophagus for food, drink,
and water.
to go through the esophagus and into the
For a minute, I was going to ask you,
stomach.
what does the esophagus have to do with this? Then I remember, oh my God, we eat.
Oh,
We
yes. Exactly. And there are that same junction in there. Yeah, that's the reason why, we'll come into the details on, that's the reason why you don't want to choke when you're eating or drinking, because they're so close. And if the food and water goes the wrong way, you choke with a reflex cough to get it back out. So that is the function of it. And like I said, the vocal cords are right in the middle of the larynx there. And those are the main issues with the larynx, to generate voice, to open into the airway, and to control what goes on. It's a very narrow space, which must be so jealously
Right.
protected.
Oh.
Because if you choke and the space narrows for whatever reasons, for disease conditions, the air entry reduces.
Right. And does it affect the vocal cord at once?
The issue may be the vocal cords. Well, it may be
I mean,
supraglottic.
if you choke, can it affect the vocal cord?
No. It affects whatever substance has gone into the trachea wrongly, food or drink. So the cough reflex propels it out.
Yeah.
And it can be irritating. It depends on how much goes in there.
Right,
because you're not
right.
supposed to have food or drink in the trachea at all.
Right.
And the vocal cord, that larynx, that level controls the glottis level.
Right. So how exactly does the vocal cord actually produce different sounds in our voice? Like now I
Interesting.
can sound like this. But I can
Interesting.
also sound like this too.
Yeah.
So how does
So
that
that's
work?
the projection.
Yeah.
All right. Now, the whole generation is for the two cords, V-shaped,
Right.
to come together. The lips of the cord vibrate, and then they generate the sound, depending on what you're pushing out.
Right.
So you can change it, you can bring it down, depending on the volume and how you're propelling it.
Right.
But what is responsible is the lips of the vocal cords that must come together to vibrate, to generate the sound. So if there's anything that prevents them from coming together to vibrate and to generate the sounds, then we say you're hoarse. You're hoarse temporarily, permanently, for whatever reason. If it's temporary, go to a wakekeeping, you go to a football match, you go shout and you're hoarse, no problem. Give it 2-3 days, you're good. But if you're hoarse that extends permanently, getting worse for long periods of time, I'll be interested in seeing your cords, see what's going on there.
Right.
So that you can appropriately diagnose and know how to help.
Wow. Okay, so now let's talk about the health the health disorders of, the larynx. What are some of the most common disorders that we see that affects the larynx and probably that affects your voice? Because you talk about your voice being hoarse.
Hoarseness.
Sometimes people actually lose their voice completely. So what are some of the disorders that cause maybe one to lose their voice completely?
Very well. So initially, the earliest thing that will give you trouble will be an infection of the larynx, the vocal cords. Talk about laryngitis infection. If you have an acute infection, we treat it, you're gone, it's done. If you have a chronic infection with the lips, the smoothness of the lips being affected, it affects the vibration and the function thereof. So the quality of your voice changes. Now, you can get a cyst on it. You can get a polyp on it. Okay, you can get edema, collection of water on the cords. You're hoarse. Your voice is changing. You need to find out why the voice is changing, for what reason. So you can get a cyst on it, you can get a swelling or water edema on it, you can get a polyp on it, you can get a granuloma on it, on the cords. And that will mean that when the voice is being used to generate voice, it doesn't come together in a position because there's something blocking it. Okay? That's initial issues. All right? Then you can even have, I don't want to go.
I know. I think I know it.
I don't want to go there.
I know it.
But you could also have a paralysis of the cord.
Yeah.
Okay? For some reason, if the recurrent laryngeal nerve is affected, you can paralyze it. You can paralyze median, can paralyze medial, you can paralyze laterally. And if it paralyzes laterally, that means the other cord cannot meet it. So your voice is hollow. Because the cords are not meeting. All right? The cords are not meeting, so you have to take care of that. And you can have CIS, you can have metaplasia, you can have leukoplakia, you can have metaplasia, you can have carcinoma in situ.
Right now. So the larynx is inside your throat.
Yep.
All the way inside. But you can have all these problems. So how can you protect it, or how can you avoid having these problems?
Once again, it comes to you knowing yourself, knowing your voice, and paying attention to the quality of your voice. Number one is the voice, and number two is air entry. All right. So let's take the voice. If your voice has been the same, normal, you don't have any problem. But when the voice changes, okay, it becomes a little deeper, you're hoarse, you're screeching, having to clear because you think there's a foreign body or something in there, you're screeching. The quality of your voice has changed. Okay? Is it just a common cold? Is it just a pharyngitis that is roached down to become a laryngitis? Or what is it? Okay, so we will need to now find out why you're hoarse.
Yeah.
And it mean examining in the clinic. You know where it is, way down there. Okay. So now you have to use your scopes.
Yeah.
Get
and
in
put
there.
it inside again.
Right. You know it. So
when
get
you
in
find
there
an
and now
endoscopy,
see it.
Is that an endoscopy or?
No, that's not endoscopy.
Yeah.
Yeah, that's laryngoscopy.
Laryngoscopy, because endo is all the way down.
Endo will be all the way. It's a form of endoscope.
Yeah.
But because it's the larynx, we just call it laryngoscopy.
Wow.
Yeah. So gastroscopy, then you're going with a scope right into the stomach.
Yeah.
Exactly. So now we scope it, get to see the cord, see the form of it, see the function of it, see if there are any masses or any growths on it, any water collection on it. Then we know what exactly is causing the issue.
Right.
Then appropriately address it.
Right. So everybody's talking about the weather right now, and the weather. We have a cold, we have a cough.
We're in winter.
Yeah, we're probably in winter, African winter, and it sort of like affects the voice too. Should that be a problem? Should we be running to you to check what's going on, or that's normal?
The weather shouldn't affect your voice.
No, I mean when you have a cold.
Yeah, you can have a cold. It's all in the upper respiratory, okay? It hasn't gone down to the lower respiratory. And necessarily, it can, your cold, like I said, can get infected.
Yeah.
But if your common cold, runny nose, allergic rhinitis, it hasn't got into your cords yet.
Right.
The quality of your voice should not be affected unless you get a laryngitis, acute or chronic, to affect the cords and then the lips, the smoothness of the lips of the cord. Then your voice can change momentarily and transiently.
Right.
Once the infection is over, you should get your voice
Everything
back.
should be cleared.
Yeah.
So you shouldn't be worried.
Not at all.
All right. What about acid reflux or reflux issues? I've seen reflux issues affecting voice.
Yeah, I have just discussed that issue right away. Now, reflux disease, based on the fact that your sphincter, the lower sphincter, gastroesophageal sphincter, is kind of weak. So it doesn't close completely. All right? So that's what we call gastroesophageal reflux disease. So supposedly or theoretically, when you lie flat, gastric contents come through the sphincter and into your esophagus to give you what we call heartburns. It has nothing to do with the heart, but it gives you heartburns because you're not supposed to have acid in the esophagus. So it gives you heartburns. But now it's being blamed for hoarseness and voice change, which is absurd because it doesn't go all the way to your vocal cords. It's not possible. Otherwise, you choke in your sleep.
Right.
Right? So even if you have some liquid gastric fluid coming into your throat, fine, up there. It may irritate the back of your throat, but not into your larynx.
Yeah.
Because it has to go bypass the esophagus from the epiglottis. All right? Because the epiglottis is a flap that covers the larynx when you're swallowing. If that doesn't function well, you will choke when you're eating or drinking.
Yeah.
So for it to bypass the gastric fluid to go all the way to affect your cords is a no-no for me.
Yeah.
It can irritate your back of it if you get some coming up, but not to your cords, because you will choke. It's not just irritating your vocal cords. It's fluid going down the wrong way, down the trachea, into the windpipe, going into the lungs, bronchioles, and into the lungs.
Right, right.
So I will not blame
acid
hoarseness
on
acid reflux.
Right. So are there any warning signs of some of the conditions that you've mentioned, like polyps, nodules, laryngeal conditions, and even cancer? Like, are there any warning signs? Because I've heard about people having cancer down there. So are there any warning signs that people should look out for to say, look, I feel something very odd. I need to run to you right now?
Number one, voice quality. Number two, air entry. Now, if whatever swelling out there is so huge, okay, and the space in the glottis is so narrowed, I've had patients come in who are wheezing. They have serious stridor. Stridor is noisy breathing.
Yeah, so they're wheezing.
That whole V-shaped is reduced to like that. So it's coming.
You can take your hand up a little bit so people can see that, yeah?
Okay, so, all right. If you have the vocal cords, like that's the glottis area. That's the anterior part, that's the posterior part. That's the glottis area, okay? So now if this space is a small space, and that's the entrance into the lungs, the air entry. So if this space here is so narrowed by a growth and reduced to just a little portion, the air has to now rush through. So it becomes noisy.
So they'll be wheezing.
Wheezing, or stridor, we call it, inspired. If you go see, the whole glottis is covered by a mass. And why would you get there when your voice had been changing for the past year, 2 years, 6 months, and the mass is growing, and it grows so heavily, covers nearly the whole glottis. And you know some of the solutions for this one here temporarily?
What is it?
The air is so reduced, you have to go down here and put a tube in there.
Yeah, and then it takes...
So that it bypasses the larynx so you can breathe through a new nose we give you in the neck.
So is that also the condition?
Tracheostomy, we call that.
Yes, I was gonna ask that. So basically, when the mass is removed, or when the mass is taken off, so that means the person loses their voice completely, and it's using that machine. Because I feel like I see it when they want to speak, they have to press on that thing.
Yes, this is the reason why. When you've taken the whole thing out, it depends on how much you take out. If you can preserve the cords and you just remove the mass, the cords functions back again because the obstruction has been removed. But if it's eating away the cord already, then it's gone. Now, if you put a tracheostomy tube here, it bypasses your, your larynx. So you breathe in here. Now you have specialized tubes that have an opening.
Yeah.
Okay, so that one that can open up and then allow you to vocalize.
Yeah.
Some are solid, you cannot use your voice, forget it.
Oh, wow.
But if you have the perforated one, you can now press, that's why you put pressure here, so the air will be redirected.
And it changes the voice completely.
Yeah. There's some people who are using phones on the neck to actually vocalize, amplify the thing because the larynx is gone. Yeah, we can do laryngectomy and remove the whole larynx.
Oh my God. So Doc, we have a question for you right now. Hello, can you please ask Dr. Obodai about what causes kids not to speak early and if there are steps to take to resolve it quickly, as many parents are quietly frustrated, are now quietly frustrated.
Okay, that's delayed speech.
Yeah.
Delayed speech, basically and plainly, we will start with their hearing. Okay, because if you don't hear, you don't speak. Because speaking is a repetition of what you have heard.
Yes.
So you hear and then you repeat. So if you're not hearing, you're not speaking at all. That's the way it goes. So now we're going to find out what's happening with the hearing.
Yeah.
There are other kids who are hearing, but neurologically, the speech is delayed. Okay? So the neurologists come in, they want to find out what's going on. Speech therapists come in to want to find out why. Once we've established that the kid can hear, then he should be able to speak. He or she should be able to speak. So now, why is it delayed? Neurologically, centrally, whatever. So neurologists will come in, the pediatricians, neurologists kind of will come in, and then speech therapists will come in to now understand what it is. Because we have ruled out morphologically that there isn't any hearing problem to create that delayed speech. But I've known people who have talked after a year and a half, after 2 years, and then get trained and they pick it up because they have the reserves.
Right.
If they don't have the reserves, you might as well go to the sign language.
Right. So you were talking about the
vocal cords.
Vocal cords, and we have them on the screen right now.
Very good.
Yes. So let's go through it again.
Very good. Okay. So let me. All right. Which camera? All right. So you have to see too. All right. So what we're saying is this. This is the vocal cord. All right. This is looking at it indirect. We do indirect and we do direct. This indirect, so the anterior part is down here. So this is left, this is right. Now, this is the entrance into the lines you're seeing here is the trachea.
In the trachea.
So the air goes through here into the lungs. And this is the whole space you have. You don't have any other area for the air to go through. So if a mass grows here, grows all the way there, grows all the way there, and covers this whole place, all you have is this one here. So the normal volume of air that is going through here must now rush through here. That is how come you have the noise. So it's going, saturation probably also falling, oxygen saturation probably falling. This is critical. Now, you're not going to sit and then take these ones out here while he's out there. So now, that's how come the tracheostomy comes in. That's a very bad case anyway. But if you have a node here, it's something we call Singer's nodes. It grows up here, the anterior third.
Singer's nodes?
Yes.
Does it happen to singers a lot?
Yes, that's what we call it, Singer's nodes.
Oh, okay.
So now, it's a small one. It doesn't affect the air entry.
Yeah.
It's a small. It affects the quality of your voice because it affects the position of the cords. So that's sitting right here. You can have a cyst here. You can have intubation granuloma sitting here. That's okay. The air entry goes in. It affects the quality of your voice. So there are two things: the voice quality and then the entrance of air.
So can you take them away?
But yes, we do surgery. We surgically remove them. So that's what I mean.
How long will this procedure take?
Oh, it shouldn't take too long. My part shouldn't take too long. It will take somebody to put you to sleep. Then I come in, do it out, then they wake you up. So my part of it is very small.
But what is the healing procedure like?
No, he's very fast.
Okay.
If it's a polyp, and I just snap it, end of story.
Yeah.
It heals. If it's a, what do you call it, edema, water collection,
You just lose it.
slice it, drain the water, put it back. It closes very fast.
Right.
If it's a polyp, just snap it. It goes
Yeah.
away.
How long can
If
a polyp last in someone's larynx?
Larynx.
Larynx, sorry.
It can say that it can grow. If you don't take it out, it can grow. If it doesn't shrink, it will grow. All right. But then if it's an active mass, okay, that is growing, then it is still growing. It's active, it's growing. So then you have to take it out quickly and then know what it is.
Biopsy and all
rather
that.
than wait, biopsy it and get a pathologist to work on it. Rather than wait for it to bring you to that point of stridor,
yeah.
then you're already getting into a critical situation. Okay, because if it blocks totally and it affects your oxygen saturation, and the ENT man you meet cannot enter your
Cannot do
trachea
anything, yeah.
in good time,
Anyway.
we're good.
Good morning. I hear my speech in my left ear when I speak sometimes. Kindly ask Doc what that might be and what I can do about it.
You hear movement in the
No, you
left
hear
ear
this.
or you hear the sound.
His or her speech in their left ear.
Is the sound, is the volume of the sound that you hear, is a tubal issue.
Tubal issue.
Yeah, the tubus eustachiae. The eustachian tube that joins the middle ear to
Right.
the nasopharynx.
So what's the
So
person
probably
supposed
the
to do?
air is just, it's like when you hold your nose and
Yeah.
you press, it
Yeah,
pops.
it pops.
That is a tubal function,
Oh.
all right? So if she's speaking and she's hearing it in the ear, it's probably going through the tube into the ear.
So what's the person supposed to do?
What is supposed to do? Let's find out what is going on. Let's see whether it is actually that kind of pathology or what is going on in the
Right.
back of the throat. And then you can probably be able to talk to sort it out.
Wow. Anyway, are there any lifestyle or diet changes one is supposed to make when it comes to protecting your larynx and your voice? Say alcohol, say
Maybe-
misuse of smoking, drugs.
Yeah,
Tell us.
certainly.
Cold
Let me
water,
start.
ice block.
Yeah, let me. yeah. Okay, let me start with the innocuous one. The lifestyle issues that affect the cords will be typically smoke, alcohol to some degree, but smoke, because smoke goes directly through the vocal cords, through the larynx, into the trachea and into the lungs. So the first point of abuse in the lower respiratory system is the vocal cords. That is why smokers have that kind of voice, because the cords are irritated. But if you ask me about food substances, I always give a funny joke when I talk about banana improving the quality of your voice.
We swallow it. You swallow the banana.
Yeah.
You open the banana, you swallow the full thing if you're a singer. That's what I've heard a lot of singers do.
Why?
Because that's
It's
what we're
going
told.
straight into your stomach through your esophagus. Your vocal cord is somewhere else. If you convince me,
I get it. So it's going to your stomach. It's not even touching the vocal cord.
please. If you convince me that there's some ingredients in the banana that aids the vocal cords when it's been absorbed, okay, I'll give it
No,
to
they
you.
say opens up the
But
vocal.
if the banana is supposed to smoothen your vocal
Yeah.
cords to increase the quality of your voice, then you lost me there. Because it doesn't go through the cords at all. Straight into your stomach.
Oh, Doc.
Okay.
You just bust our bubble.
So food substances, particularly apart from alcohol and cigarettes, that would directly affect your cords.
Right.
I will not put a finger on anything else that would give it up. Drinks, fruits, supplements, not for your vocal cords.
Yeah.
General health, fine.
Right.
But not for your cords.
So what about chewing ginger?
Oh, please.
Oh,
It
please,
doesn't
guys.
mean that your cord.
Well, Doc, you just bust my bubble because I remember when I used to be in the choir as a young person way back in school, and they said, "Oh no, take banana, swallow it." I was just swallowing bananas.
How many did you swallow?
Like a lot. And then the bananas are so big, and you're just like, God,
Oh, Lord.
God, I'm trying to sing for you.
To what purpose?
Anyway, Doc, we have one last question here.
Okay.
Doctor, my son is almost 15 months old. I've noticed that when
15
he
months.
speaks, for example, when he says yes, he tends to place his tongue between his teeth. He's probably lips.
Listen, yeah.
Instead of keeping the tongue inside of his mouth for the S sound, it pushes out between the teeth. And I wanted to check if it's normal at his age or as part of his speech development, or it might be something that needs early attention. Is it lip?
Yeah, the lips, yeah.
Lip child.
That is a genetic thing. If it's the people who come with that kind of pronunciation.
Yeah.
All right. I mean, you're not doing anything about it. That's the
Yeah.
way the person is coming.
Yeah.
The people who are vocalizing, they're not even forming some consonants well.
Yeah.
All right. If there's a condition that's predisposes to that, then it's a different story. Like palate issue, cleft palate, kind of cleft lips. Those
Yeah,
are
that's an
different
issue.
stories.
Yeah.
But with all those things excluded, if typically the S,
F,
yeah,
is.
that's what I want to do,
So the
as a lip sync. Sorry
All
about
right.
that.
So good morning and thank you for this show. Thank you too for watching. I feel the presence of something in my throat whenever
Okay.
swallowing saliva, but don't feel it when swallowing food. I bring out some particles from the throat from time to time. And what could be the cause of this and how can I mitigate it? Is it talking about tonsil stones?
Possibly.
But do you
Possibly.
feel tonsil stones when you swallow water?
No, that's a different thing.
Yeah.
It's a very, very loaded question, about 3 in 1. The swallowing part may just be from a chronic, allergic irritation.
Yeah.
So you have lymphatic tissues that build on the pharynx.
Yeah.
You look at it, you see kind of reddish. It's not inflamed.
Yeah.
It's just irritated. So your own tongue touches it. It feels like a foreign body.
Oh.
So you want to clear.
So your tongue can touch your...
Yeah, the back of your tongue. So it feels like a foreign body. You want to clear. But there's nothing foreign there. It's your own tissue.
Right.
But concerning the what do you call it? The particles, I
Yeah.
believe it's just tonsillar stones
Tonsil
that you
stones.
get cough up
Right.
once in a while.
Okay. So, Doc, before we let you go, of course, we will need the tip of the day. What's the tip of the
Yes.
day we're looking at today?
So the tip of the day today, like we have just discussed, we want you to take interest and get to know the quality of your own voice. If there's a little change, you should be able to work at it and do well to preserve it, because that is an identity issue.
Right.
So preserve the quality of your voice. We've added, air entry and all that.
Yeah.
But basically, we talk about chords, your quality.
Right.
Very important.
All right. And on that note, stop swallowing bananas. It's not going to do anything to you. It's not going to smoothen the voice. It's not going to make you sing better. Just take care of your voice box, all right, with everything Doc just said. And also thank you to everyone that sent in their messages. If we can't read your messages, we promise that it will be read next week right here before we start our next topic. But we've been speaking to Brigadier General Dr. Ni Obodai, who's an ear and nose and throat surgeon and the former commander at the 37 Military Hospital, and now a medical director of Roseburg ENT Clinic at East Legon, Accra. What's the number to reach you on?
0244 380 802 054 7722
All right,
You
thank
may
you.
also Google Roseburg ENT Clinic.
Yeah, and they
bring
come
it right
through.
there.
All right, thank you so much. And like we told you, this show is actually the first consultation to your main consultation at the hospital. And thank you so much for joining us. This has been Doctor in the House. My name is Chris Carter.